The following is a NUR610 presentation for the QM-4 Acute Care ICU group about our conceptual freestanding emergency center. Each group member contributed an array of slide presentations, edits, references, and composition tasks to see this project to completion. During this presentation, we will describe our conceptualized emergency center, its organization and setting, patient demographics and epidemiologies, as well as social and behavioral detriments. We will touch on our team composition, evidence supporting our concept of a freestanding emergency center, our funding, technologies, and applicable laws. So what is Oak Mountain Emergency Center? Our Oak Mountain Emergency Center is a freestanding emergency room in the suburban area of Birmingham, Alabama. The purpose of our facility is to provide 24-hour emergency services for those in outlying areas of the city who are unable to get to a hospital quickly. We will work closely and function as a microsystem within the Department of UAB Hospital in Birmingham, Alabama. Its intent is to reduce overcrowding in the hospital-based emergency department as well as provide convenient care to a growing population near and around the hospital. Our facility will house a laboratory and radiology department for x-rays, ultrasounds, and CT scans. The Oak Mountain Emergency Center will be made up of a separate department under the Director of Emergency Services for the original UAB School of Medicine. Our facility will be staffed with board-certified emergency medicine physicians, nurse practitioners, ACLS and PAL certified registered nurses, and patient care technicians. We'll have the normal ancillary staff that's usually included in an emergency room to include X-ray and CT technicians as long as environmental and registration personnel. Our unit manager will be an advanced practice RN with a degree in nursing and health service administration. She will report directly to the Director of Emergency Services. We also will employ a nurse educator who will be staffed to assist new employees and current employees updating on evidence-based practice, their current certifications, and any in-house education that might arise. Registration staff will check in patients, verify insurance, and collect co-payments. Our Oak Mountain Emergency Center will be located in Shelby County, Alabama. Our population, according to the Census Bureau of 2014, was around 204,180. Shelby County includes several large suburban cities plus outlying rural areas. The population growth between 2010 and 2013 was estimated at around 4.7%. Currently, there's only one major medical center in southwest Shelby County, Alabama. Our Oak Mountain Emergency Center will be located in North Shelby County at the intersection of Highway 280 and Highway 119, as evidenced by the red arrow on the map. This area south of Birmingham has limited direct access to hospitals downtown due to the growing population and traffic congestion. We also will be near a commercial center and convenient to the interstate. At our facility, we'll have an FAA-approved heliport for contracted helicopter transport during high traffic times or acute patients. And our emergency center will have access to the UAB critical care transport as well as a standing contract with local ambulance transport companies for hospital admissions. A microsystem is a functional unit where frontline staff provide care to patients at the unit level or within the unit itself. There are a variety of other microsystems at work here. Our emergency center is a microsystem extension of the UAB health system, which is a macrosystem. Our Oak Mountain Emergency Center will have educators that will assist patients with any educational needs ranging from diabetes to hypertension. Macrosystems are bigger systems made of smaller systems. Microsystems are only one building block of the larger macrosystems of UAB hospitals. Here are some statistics. There were 129 million ER visits in the U.S. in 2011. UAB Emergency Department reported 83,433 ER visits last year alone. Shelby Baptist Medical Center reported 48,612 ER visits per year. The need for ER care has increased by 22% over the last decade. The ERs have become overcrowded, oftentimes increasing wait times to greater than 3 hours for urgent care conditions. In Alabama, there's some health disparities that exist. Alabama ranks 47th in overall health, 800,000 uninsured people in Alabama, and ER serves as a primary care for uninsured patients. According to the graph, cigarettes, inactivity, obesity, sweet tea are some of the major contributing factors to ER visits. The innovations at Oak Mountain Emergency Center. Our satellite emergency center will offer top-of-the-line emergency room care at a reasonable distance for those not living in the metro area of Birmingham. The clinic offers all functions of the UAB hospital ED, including imaging, laboratory, and trauma stabilization. Average wait times will be posted online, giving the not-so-emergent patient the option to wait for a less busy time. Streamlining of patient admissions to UAB hospital when necessary will also decrease the wait times for the UAB emergency room. Readily available critical care transport for the trauma, acute MI, and stroke patient after stabilizing will also be available for our Oak Mountain Emergency Center. Our emergency center will use state-of-the-art Cerner programs just as the UAB hospital does. This allows for ease of transition to the main hospital when admission is needed. The emergency medical record will allow charts and images to be reviewed from main campus if the consult is required. For patients requiring admission, bed requests can be made from the clinic and the patient can wait for a bed at our emergency center without going into the hospital. The Hospital Consumer Assessment of Healthcare Providers and Systems Survey from Press Ganey will be used as it is at UAB. Only the scores acceptable at UAB will be acceptable at the clinic. The goal of the clinic is to hopefully improve the HCAHPS scores due to ease of access to quality care and decreased stress and wait time from the main campus ED. Our financial plans. Payment methods accepted at the Oak Mountain Emergency Center include self-pay, UAB charity care, Medicaid, Medicare, TRICARE, and all types of private insurance. Our predicted staffing budget of $4 million includes core staff and miscellaneous staff. Their predicted equipment cost and maintenance are around $3 million, a yearly mortgage of $35,000, additional cost of $750,000 with a total operating budget of $7.8 million. How are we going to survive while still making money at the Oak Mountain Emergency Center? Our market's in a prime location with easy access to all patients. An average patient volume is estimated around 30 to 40 a day. Visit times are targeted at less than 60 minutes for minor illnesses, 24/7 around-the-clock care, average shorter wait times with quality care. We will support the community, market on billboards and primary care offices, and we'll have a staff of 2 emergency physicians, 2 nurse practitioners, 10 registered nurses, 4 patient care technicians, 5 radiology technicians, a radiologist based out of the UAB hospital, and 5 laboratory technicians. Our APRN roles will be to work closely with on-site doctors and support staff. They will assess and treat patients in consultation with the attending physician. The advanced practice registered nurse will communicate orders as needed with nurses and PCTs. Some other great benefits of the Oak Mountain Emergency Center. We'll be able to deliver quality care to all age groups. We'll have a decrease in wait time, 24/7 care, emergency care, up-to-date technology, accept all forms of payment, and have transfer services on site. Some policy matters. EMTALA. The Emergency Medical Treatment and Active Labor Act went into effect August 1, 1986 to protect the medically uninsured from patient dumping at certain facilities. This legislation requires patients to be evaluated and stabilized prior to transportation to another medical facility. In 1989, an amendment was made to an EMTALA, which required higher-level facilities to accept patients being transferred from a lower-level facility if the facility had a capability to deliver more appropriate care to the patient. This amendment would apply directly to UAB, Oak Mountain Emergency Center, and the UAB Hospital in Birmingham, Alabama. The Oak Mountain Emergency Center will be able to evaluate and stabilize patients who will need to transfer them to the main UAB hospital for further care. And this concludes our presentation.